So how do you get referred for TRT on the NHS? So if you have symptoms such as low mood, poor energy, maybe you have libido issues, maybe you have erectile dysfunction, the first thing to do is see your NHS GP and ask for a testosterone blood test. Now, most GPs will be happy to do that blood test, and once you've done it, which is normally a morning sample, so somewhere between 7 and 11 a.m, and you have to be fasted as well, your GP will then get a result in their inbox. Now, there's usually a reference range attached to that result. So it can be anywhere from, say, 8 to 29 nanomoles per litre. Now, if you're above 8 nanomoles per litre as a general rule in the UK, you won't be eligible for TRT on the NHS. Now, if you're under 8 on the first blood sample, that needs to be repeated 4 weeks later on a second sample. And if both samples are under 8 nanomoles per litre, at that point you may be eligible for a referral. Your GP will often check other blood tests such as prolactin, which can suppress the testosterone, and things like gonadotropins, so FSH or LH, and that helps to differentiate, is the problem with the hypothalamus or pituitary gland not sending the signals to the testicles, or number 2, is the problem primary testicular failure, so the testicles are just not working or producing testosterone. Now, you'll then be referred to an NHS endocrinologist, which can often take about 1 to 2 years waiting times for the referrals. It's important to remember at that point, TRT is still not a definite. It depends on the endocrinologist, and they may sometimes ask to do the sample again or ask to wait a bit longer to see if your testosterone levels recover. In terms of options available of TRT, so there's 3 main options. So number 1 is testosterone gels or creams. Now, these are applied daily. They need to be to a clean shaven area. So some of them you apply to the shoulder, some of them you apply directly to the scrotum. You have to leave it to dry for 10 minutes, so that can be a little bit cumbersome for some men. And that's one of the main issues, is compliance. After a couple of years, a lot of men are not using the cream properly. The other issue you can get is you can get transfer of the cream or the gel to family members. So for example, if you were to cuddle your wife and you've got it on your shoulder or your arm, or cuddle your kids, you'd have to be careful because it can transfer to them. So that's something you really have to watch out for. Another issue I find is often patients get quite poor absorption with testosterone gels and creams. So they could be taking it exactly how it's intended to be taken and they've got good compliance, but the testosterone levels just don't improve really. The second option you may be offered on the NHS is libido, so testosterone undecanoate, which is a long-acting ester of testosterone, and it's injected approximately every 10 to 14 weeks. It's a 1,000 milligram dose, and it forms a depot in the buttock where it's normally injected, so it's a 4 ml depot, and then slowly it's released over that period of 10 to 14 weeks. Now, the problem with libido, the main problem is you get a big supraphysiological peak around about in the first few weeks, and then gradually the testosterone levels start declining. A lot of patients can feel that, particularly towards the tail end of that period. So for example, you may feel okay, but around about week 8, week 9, you start getting all the symptoms again that you had originally. So low mood, low energy, feeling tired all the time. Something you can do is you can shorten the interval of libido. So for example, you could have it every 10 weeks rather than every 12 weeks, and sometimes that can help. Another option that I sometimes like to do is use testosterone gel or cream in the last 1 or 2 weeks, just to top up the testosterone levels, but that is off license. The other main issue I have with libido is it's not really adjustable. So if you get side effects or if it's not working for you, you then have to wait 12 to 14 weeks for the next injection, or for it to, for most of it to have left your system. For example, if you compare that to cypionate, you can adjust the dosage anytime you want to. The third option the NHS sometimes offers is Sustanon. Now, that's usually injected every 3 to 4 weeks, and it's a mix of 4 different esters. Some are short acting and some are medium or longer acting. Now, once again, the main problem with Sustanon is you get a lot of fluctuations in your symptoms. So sometimes when, a few days after the injection, you might get hot flushes, you might feel anxious, you might get mood swings. And then a week or 2 weeks after, you may feel the low testosterone symptoms again. So Sustanon is not my preferred option either. So these are the options on the NHS. And the other thing to consider is you generally don't get any fertility medications on the NHS. So options like clomiphene or HCG to use alongside TRT. Now, if you go to private clinics, usually the option I like to use is testosterone cypionate at Men's Medical Clinic. It's got a half-life of around 7 to 8 days. It is unlicensed, but it's safe to use, and you can really adjust the dosing schedule depending on the patient. So for example, a lot of the patients that we have, anywhere from once a week to twice a week to every single day microdosing. So you can really adjust the doses and make sure you optimize that patient's TRT regimen. Obviously, in private clinics, you also have options to HCG and clomiphene, but obviously I understand that cost can be an expense for a lot of patients, and that's why going the NHS route might make sense, particularly if you've got very low testosterone levels. If you've ever had some testosterone results you're not sure about, at Men's Medical Clinic we offer free consultations. It's something that I offer because I like to talk about TRT, and there's no obligation to continue treatment with us.